saying a course is marketable doesn't mean that you can't do all the other courses. It only means that there are some courses which are more marketable than others, but you can still do whichever course that you want to do as long as you have passion for it. You can still do it and you can still get a job. So it's like all the courses are marketable, it's only that some of them are more marketable than others. And for me personally, what I consider before telling someone a course is marketable is like how many employees are needed depending on that course to be able to be employed in the hospital, and also like what are the chances of you getting your own thing like a pharmacy or your own lab outside there. So that is something that I consider before telling someone that this course is marketable. So today I wanted to mention for you and to explain for you some of the courses which I personally consider as marketable, that is for KMTC and even for the university, and even when you get out of this place to go and work. Hello beautiful people, welcome back to my channel. If you're new here, my name is Lesodor, and on this channel I talk about nursing, I give health tips and also do vlogs. So if that is something you're interested in, then you should consider subscribing. So I'll be starting from number 4. So number 4, we have pharmacy, and on each and every course that I'll be explaining to you, I'll be giving examples from the experience that I've had in the 5 years in KMTC from what I've observed. So for pharmacy, when you go to the pharmacy room, you find that we have a lot of staff, because we have those who are dispensing the medication for the outpatient, and we have those who are dispensing for the inpatient, and we have those who are like writing records, and you'll find even almost 6 of them there. And during the next shift you have like another 6, night shift another. So you find that we need more staff, and for me that just shows that because we need more staff, you can get a job. The other thing about pharmacy is that after maybe you've saved up enough money, you can open your own chemist. You can just get the Pharmacy and Drug Act, I think. Then you can open your own chemist, and that running your own business is even better. So that makes it a little bit more marketable for me. Number 3, we have medical laboratory, and for med lab, like it is also similar to pharmacy. Like we need more of them during the shifts, and because you find that like when you come here in the Muranga hospital, the lab is always busy, and so you find most of them moving around, so they have to like divide themselves. You find like 4 in one room, 4 in another room, and even 4 in another room, those who are doing the things that they do there. So you find that we need more staff even in the laboratory, so that gives a benefit for the med lab. And the other thing is that for medical laboratory, same to pharmacy, you can open your own, let's say a medical lab out here, because you find that most of the hospitals, especially the public ones, at times you find that yes, they can give you the services, but they have to send you outside to another private hospital so that you can have your test done. So if you did med lab and you have your own laboratory, you just build it next to such a hospital, so you can just imagine like how many clients you have each and every day. Number 2 is clinical medicine, and for clinical medicine also we require more staff for the inpatient and the outpatient. Although for me, like in the hospital, the clinical medicine guys, I really don't know what they do, but anyways, for clinical medicine too, when you get out of this place, like out of the hospital, you can have your own clinic. And that is what I know most of them usually do. Most of them have their own clinics, and they employ nurses, they employ med labs, and yeah, that's it. So for clinical medicine, it is also more marketable. And finally, number 1 is community health nursing, and this is not because I'm doing community health nursing, but it is because this is the whole truth. Like nursing is the most marketable, and like we need more nurses than any other career in the hospital. So you find that for nurses, even right now, like the care hasn't reached like the point that you want. Like we need, you know, for patient care, we need it to be like optimal. Like let's have like 3 to 1 nurse, and if you go like for us in Muranga hospital, you find that we have 20 to 1 nurse, or even 30 patients to 1 nurse, and that is not the care that we want. So for us to be able to reach the care for each and every patient, it is for the nurses to be able to increase in number. So the fact that we need more of them makes it like the most marketable. So that is my suggestion, and I know maybe for someone else they might be thinking differently in terms of which course is more marketable. So if you think differently, you can leave that down in the comment section, and if you have any advice for someone who is looking for a certain course maybe that you're doing, you can always leave that down in the comment section. And thank you so much for watching this specific video. See you on my next video. Bye.